Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Kelly Curtin-Hallinan. She's a pediatrician, and today's Kevin MD article is My Improbable Survival of Stage 4 Cancer. Kelly, welcome to the show.
Hi, thanks for having me, Kevin.
All right, so your article is a lot of your story. So for those who didn't get a chance to read it, just tell us a little bit about yourself and your story.
Yeah, so I am a general pediatrician living in South Central Pennsylvania. And about a year ago, I had a very shocking and honestly difficult to establish diagnosis of renal cell carcinoma, which, I have written a couple articles about this, which unfortunately was really difficult to get anybody to really take any of my symptoms seriously. Then ended up getting admitted and told I had stage 4 cancer. And then through a variety of workup that took many, many months, has eventually been downgraded to stage 3 cancer. And I'm happy to report the current plans for me to finish treatment this month. So on the advice of my oncologist, I've done some writing about my experience, just, for catharsis to help me process it. I also think as a physician, patient stories are really compelling and interesting to hear because when we see the patient, we only get a small sliver of what the experience it is, both with the healthcare system as well as their own journey. And so I think it's always really interesting to hear patient stories. I originally had written these essays just for myself, for catharsis. And honestly, I've spent the last year really staring down my own mortality, wondering how my children will know me. If I die in short order here, what, they'll know about my thoughts and those sorts of things. So, also kind of wanting to make some print, to have some things to leave them if, because it originally did look like things were going that way. So yeah, and just processing, the emotions of all of this, which, I've written 3 essays for your blog and just recently a children's book with my daughter that addresses a lot of these issues, just living in the duality of so much that I think people can really relate to.
Mm-hmm.
The duality of being both a patient and a doctor, of being, a caregiver and being taken care of experiencing, hope, but also skepticism, and sort of living in that space in between, where there are no guarantees. We don't know what's going to happen. And so I think I just wanted to share the story, for myself and for others.
You said that you had symptoms where the initial medical team or clinicians didn't take them seriously. So what kind of symptoms did you initially have?
So, like anybody with a weird diagnosis, it makes very little sense to me, even medically, but it's just what happened. I started about 4 months before I ultimately was diagnosed with cancer. I started with radicular symptoms. And at that time, it was noted that I had high blood pressure, which we thought was from pain. And so, I had a workup for that, which was an MRI and treatments, and I did improve. It was all consistent with that. But my blood pressure kept going up. Again, we still thought it was pain or related to that. They had put me on some Cymbalta for neuropathy, and they thought maybe that was the cause. And so besides neck pain, I had hypertension that I previously hadn't had. And, like middle-age symptoms, premenopausal symptoms, in my 40s, like nothing really out of bounds. And that made sense for quite a few months. I did wean off my Cymbalta, and then my blood pressure started being very crazy.
Mm-hmm.
So I did start going to the emergency room with like 200s over, 180s. I did have some workup that, at least the time I was there, was believed to be negative blood work, negative head and chest scans. And I think I was sent home twice from the emergency room just with, an anxiety diagnosis. And the last time that I had gone where I did ultimately get diagnosed, I mean, I did really have to fight to get some scans. And, I'm not mad at anybody, but they weren't nice. I mean, they told anybody could see, I'm having a panic attack. And then as it turned out, I had this enormous abdominal tumor. And then they went back and looked at my scans and found all these, abnormalities, which is why they believed it was stage 4. So like, it's just like a wild sort of whiplash of I'm fine, I'm overreacting to, I went to the ICU and maybe I have terminal cancer, So, I mean, I don't think it gets a lot more dramatic than that. I don't know that I've ever been involved in someone else's patient experience like that. And I did really have to fight reasonably hard to be taken seriously.
So what did you have to do when you said that you had to fight reasonably hard? Like, how did you do that? Did you
Sure.
involve other colleagues, family members? So what do you mean that you had to fight for these scans?
Yeah, so I keep getting sent home, right?
Hmm.
So the last time I went to the emergency room, I had seen an extender and I insisted to see the physician who, gratefully, like the last person who I feel like actually listened to me. I was having some abdominal pain. And so they did ultimately scan my abdomen and find, a 10 by 12 tumor. And, once I got diagnosed and admitted, I talked to the team and, asking, I'm a good advocate for others. Is there a way I could have advocated better for myself? Because I did really start believing that maybe I was having a psychological event, that I couldn't figure out what was going on there. Again, I don't think it makes the most medical sense. I've reviewed my chart so much, I can't explain it to you, but that's just what happened. And so, additionally, they didn't really want to admit me. I do work utilization review, and I actually called the utilization review team that I work for and asked them to send them the actual criteria for hypertensive emergency, which I certainly fit at that time. And so, I had to ask for scans. I called my PCP in between. They couldn't get me in. They didn't, I tried all the channels that I know. I'm a pediatrician, so I thought, well, maybe I'm wrong. Maybe this isn't a big deal to adult doctors. So I do work with some adult doctors and told them my story, and they're like, no, that isn't right. So, it was a couple of weeks of reaching out to colleagues, calling medical facilities, going to the emergency room. And I'm always polite, but they did tell me that, maybe a half an hour to an hour before I got diagnosed with this very large tumor, that everyone could see that I'm in the, having a panic attack, and, the emergency room isn't really the place for that. So frustrating experience for sure. I am very calm now, but, at the time I was feeling very ill and confused. And when I went to the emergency room and my blood pressure, I checked my blood pressure at home. I went in and it was that high. I did cry in triage, and it wasn't sympathetic, the response. And so,
You think as a physician yourself, right? And you've been to the emergency department several times with these objective symptoms, and to be what it sounds like almost gaslighted or dismissed, and
that's how I would
you
describe it.
yourself as a physician, like you would have a basic sense of what's serious and what's not, and yet you still encounter some of these same feelings.
So, I've heard these stories for patients, but I can honestly say I'm not sure that I believe them. I don't think they were lying. I think that maybe they were misinterpreting or something like that when patients say they present with serious things and nobody really, at least their perception was that nobody believed them. So I was surprised. There's so many factors going into everything every day: the exact person you see, the time of day you're seeing, what else is going on in those people's lives, in the emergency room itself. And so, I do understand all of that. Medicine is very difficult right now. And so I don't know if it's implicit bias as a woman in her 40s with high blood pressure. This could only be something psychological, or, burnout. We all work really hard. I wasn't there because I thought I was there because I thought I had no other choice. That wasn't where I wanted to be at that point in time. And, I understand everybody's trying to meet all their metrics. I was an unusual patient. So I was surprised, but I have heard these stories before. And so, I don't know what to do with that. It's hard to be in medicine right now. It's hard to be a doctor. It's hard to be a patient. And so, again, I'm just sort of like, purging this. I don't know what to make of all of that or to learn from that. And, and since I've been cared for since then, everybody's been really great. And I'm very grateful to live at a time when there's so much treatment and live in a place where there's so many specialists and doctors who took such good care of me. So, I'm counterbalancing it certainly with the gratitude I feel for all the people who cared for me too.
So when you first heard that you had that diagnosis of stage 4 renal cell cancer, tell us what was going through your mind and how did you process those emotions during that difficult time?
Well, they first told me about the tumor. They didn't say 4 originally. And I honestly was a little bit relieved because I was feeling kind of crazy to say, I was starting to think, I feel so sick and I'm documenting these blood pressures at home. And, maybe this is just what it is, it is to have a stressful life. So I think I initially felt relief to be like, okay, a tumor, I know what that is. We thought it would just be surgical treatment. And so to at least have something to say, this is what it is and what we're going to do, because certainly the not knowing is certainly the scariest part. And I had been previously scanned. And then when they went back and looked, they found a bunch of things that they thought maybe were metastatic cancer. So that was pretty stunning in a short period of time. But and maybe it's because I'm a pediatrician, but like my thought is certainly for my kiddos. I have all school age, three school age children. And the last thing I wanted to do was really, inflict the pain of having a sick mom or, a possibly very sick mom on them at a really, sensitive adolescent time in their lives. My kids, at least at the time, were 8 through 15. And so I grew up in a household with 6 siblings, and it was just not something I wanted for my girls. I'm very grateful Child Life came and helped me a good deal. And before I talked to them about how to talk about it, they gave me some books to read with my youngest, which did in fact inspire us to write our own children's book about the experience. But I mean, I think just like the overwhelming, like, what do I do now? I mean, just even like logistically, like, do I quit my job? Do I quit my job? Do we, take a family vacation together? What do I do? Because even though I'm the sick person, I'm still the person who does really need to make sure my girls are okay,
Mm-hmm.
which, I'm so proud of them. They come through this so strong. But yeah, it's tough. It's really tough. And lots of resources, but difficult.
And did you continue practicing medicine as a pediatrician through this?
I was off for a few months. So I had actually already been on some leave for the neck pain I was having because that was my predominant symptom. It's hard to remember, last year's a little bit of a black hole, but I was off 2 months, maybe, I think.
Mm-hmm.
And I'm on like reduced duty, but, back to working.
So you said that when you had to share this news with your daughters, there was no guidebook and or guidance in terms of what to do. So where did you turn to for that information, and what kind of advice can you share with the audience if they're in the unfortunate situation of being in that position?
Yeah, so their child life did come to see me, and they actually gave me some scripting, which I'm not sure that I can remember exactly right now, but the time was very helpful to say something along the lines of, they had already known that I wasn't well and that I went to see my doctors and we found something in my body that didn't belong there, so that I was going to need treatment to get the thing that didn't belong in my body out of my body, and that I couldn't give them all the answers because I didn't have them, but I would give it to them as appropriate and as I understood it. And they took that okay. My youngest was 8, and so that was sort of all of the conversation. And some reassurance I gave them about things that we did know. We live real close to a great hospital, and we have lots of friends and family who are going to help us out, and that they were going to be okay. No matter what, they should know that they're going to be okay. My oldest certainly picked up on the pronoun of they versus we, but it's a tough call because I don't ever want to lie to them and reassure them, because I think it's really painful to be reassured and then it'd be false reassurance. And so we just gave them information as we understood it, and that I was going to have surgery, and then we know more then. And that's how we've been approaching it sort of the whole time, that just what we know now, and we're just going to do our best and carry on, and let ourselves rely on some family. And I live in a great community where people picked my kids up, brought us
Mm-hmm.
dinner every night for 2 months, and so they did really get to see that other people really stepped up for them.
Now, after going through this ordeal, how has that changed you as a physician, and what kind of advice do you have for the other physicians and clinicians listening to this story?
Sure. I mean, like a lot of stories, sometimes it's hard what to know from this, to learn from this. But I mean, I certainly think listen to your patients. And so I know that almost everybody who presented like I did would have had an anxiety or a panic or something, but there were some objective other signs going on that maybe this didn't quite fit that. And so listening to your patients, I think, is a good takeaway. And then I don't know about for clinicians, but for, just all of us in like, and I talk about this with my girls a lot, and sort of like just learning to live in the space of uncertainty, that I can, both the duality of the different things we're feeling in our at home. So my kids got a dog as a result of me having cancer, and my youngest especially has been desperate for a dog. And then after we got the dog, she really went through this period of sort of like guilt because she only got the dog because I had cancer, and how we can feel these different things, and that's okay. So it can be lucky and unlucky. We can experience joy after grief, and that's what we wrote our book about. It's a book about her getting the dog, from both
Mm-hmm.
her and the dog's perspective. And that's just a space that it's okay to sit with. Like, we don't solve everything. We don't know what's going to happen, it's okay for things to be good and bad, happy and sad. And so
Mhm.
I don't know. I think that's a good lesson or thought for everyone in just sitting with those sorts of things.
A lot of physicians have that personality type where they want that certainty. And of course, with this story that you're telling us, and you're still living in that sphere of uncertainty. So, how do you reconcile that need for certainty given your situation?
Yeah, I mean, I understand that. I mean, when you hear, even when I tell the hard story, I do want to like rush the end and say, but I'm okay now, because I think we all want to kind of put a button or a bow on something that they're, like we can solve it. I mean, that's why we went into medicine, right? To fix people, to solve things for them. But, that's not the only thing we do. There's lots of people who cared for me that didn't solve didn't solve my problem, but
Hmm.
certainly gave me lots of care. I mean, I think that's very challenging. I want an answer. I want an assurance. I want to know how the
Yeah.
story ends. And, probably for the rest of my life, I'm going to be dealing with this. And, hopefully it's just going to be like an observation thing, but, that's just how it's going to be. And, although it's more dramatic for me, I mean, I don't know that that's different than anyone else. I know we like, makes us feel better to think, we'll know how this is going to go. We know how we're going to fix it. But, there's even in medicine, even in really certain circumstances, there's no like absolute guarantee. So
We're talking to Kelly Curtin-Hallinan. She's a pediatrician. Today's Kevin MD article is My Improbable Survival of Stage 4 Cancer. Kelly, let's end with some take home messages that you want to leave with the Kevin MD audience.
yeah, and I think a good one is just listening to your patients. Even if we can't solve or cure their problems, that doesn't mean we can't care for them and meet them where they are. And so I think that's just a good thing to remember.
Kelly, thank you so much for sharing your story time and insight. And thanks again for coming on the show.
Great. Thanks so much.